Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, we've made a selection of our 2023 Breece Fellow for this summer. The selection committee is pleased to announce that Kate Ketelhohn will join us for the summer of 2023 as the 2023 Breece Fellow, named after our founding and current executive director, George Breece, and his wife, Dena. We're very pleased that Kate will be joining us this summer for a 10-week fully paid fellowship where she will come to Washington. She'll shadow me and the NAAOP offices, and she'll learn about orthotic and prosthetic policy and advocacy in the broader context of healthcare, rehabilitation, and disability. Kate will learn a lot this summer, but she brings some great skills to this fellowship. She ultimately was selected out of a very competitive field. We were very grateful for all of those who applied to the fellowship and went through an arduous process to reach the selection of Kate. Kate currently is a sophomore at Johns Hopkins University. She's in a pre-med track, a biology major, and she's got a very distinguished academic record thus far. She's got a number of scholarships. She's used and has orthotic and prosthetic care throughout her lifetime, and ultimately both the upper and lower extremity being impacted, and has done just exceptionally well. Kate also is in the theater program and is very interested in the theater. That's helped her shape her communication skills. So in addition to her ability to write and her academic achievements, she's also really a great communicator, very good oral advocate, and that certainly stood out in the interview process. We welcome her, and we look forward to having her report directly when she comes on board in late May, and will stay in the fellowship through early August of 2023. Kate joins 5 previous Breece Fellows, all of whom are currently working in the O&P field in some capacity. Nicole Verkeilen, our first Breece Fellow, Susanna Eggendahl, both work and do really incredible things at the American Orthotic Prosthetic Association. Lucas DeLuca works with the Amputee Coalition on community outreach. Alicia Carver helps the NAAOP with social media and is just a wonderful Indiana state advocate. And ultimately, Nikki Grace Strader, last year's fellow, along with Lucas. Nikki is with the Osseointegration International and works closely with many people in Washington on O&P policy. So we're grateful that Kate has agreed to join us, and we're looking forward to adding her to the roster of Breece Fellows. Now, let me quickly turn to an important development this week on Medicare Advantage. As you probably know, Medicare Advantage covers now just about half of the Medicare beneficiaries across the country. And yet there are very few standards for how Medicare Advantage plans make their decisions about coverage and payment. Ultimately, the new rule that just came out, NAAOP, working with the O&P Alliance and its partners in the O&P field, ultimately did submit comments, extensive comments on this proposed rule last fall. And just this week, that final regulation was issued. I'm pleased to say that there are some really important new developments in how Medicare Advantage plans can use prior authorization, how they need to use standards for coverage that are consistent with the Part A of the program, and ultimately the fee-for-service program, and ultimately very important requirements around who can review the claims and the requirements for education and training for the MA reviewers, so that they're not denying O&P claims with very little knowledge of orthotics and prosthetics. More to follow, but this is a really important rule, and we're very pleased to have supported it all along, and very grateful that CMS published this final rule despite really strong advocacy from the health plans against the rule. Thanks very much. We appreciate it.